Hi, my name is Courtney. I'm a postpartum doula. I am here with Leah, and we're going to talk about some pelvic floor physiotherapy, right? That's the
Yeah,
actual term for it. Perfect. Sweet. So Leah, do you want to tell us a bit about who you are?
yeah, for sure. Well, thank you for having me on here. I think it's such an important area to talk about kind of throughout a lifespan, to be honest. But then especially when you're in that perinatal kind of pregnancy, birth prep, postpartum. So my name's Lea Damata. I am a physiotherapist, and I have a special interest in pelvic health. Sometimes we call pelvic floor physio, sometimes we call pelvic health. I tend to just say pelvic health because it encapsulates so much more than just the pelvic floor, and we'll talk about what that is.
Yeah.
But that is where I specialize, and I actually also do pediatrics. And the other hat that I
Hmm.
wear is I'm a mom of a 16-month-old, so it's been really interesting to kind of go through that experience firsthand and kind of shifts how you view it and how you talk about things. So I'm really excited to be on here to talk about that or the population that might be listening to this. And then so I'm actually located out of Ontario because I know you're in Calgary, in Toronto, and I have my own practice called Raise the Bar Physio, and I do that as my kind of passion project where I do pelvic physio, but I also work at a pediatric rehab hospital. So that's where my pediatric side is.
Cool.
But we don't need to talk about it, but if there are any parents who are interested in things like incontinence and bedwetting, that's kind of an area that I also specialize in.
Okay, cool. I didn't even know that it was for kids too. When I think like pelvic health, my first instinct is just moms for some reason. Like I wouldn't have even thought that this is something that if I didn't have kids that I would need kind of
Yes.
thing. I didn't even know about it until actually my second child, my daughter.
Okay.
And I had no idea what it was. I'm like, someone recommended it. I'm like, yeah, cool. I'll check it out. Like, sounds
Yeah.
good. I was very shocked when I learned what it was. So
No,
I think
for
this is a
sure.
topic that a lot of moms kind of don't really have that education on or like the knowledge of it because I don't feel like it's a well talked about topic at all, actually. I've talked to a lot of moms who are like, oh, that's a thing. Like, why would I do that? And I'm like, well, because it's good for you. Like, I don't know. I'm still learning about it too. Like, yeah, it's not a well talked about topic, I don't think.
I think
So,
it's getting
um,
better. It is very
yeah.
taboo, and I think that's part of it. Like you talk about things that maybe most people aren't comfortable. Where if this is the first time, it's also nice because you can hear about it without having to feel like you have to ask these kind of TMI, kind of like scary questions. But it's getting
Yeah.
better. But you're so right that like some people still aren't well aware of what it is, and I'm so excited to kind of dive into that topic today.
Yeah, me too. I'm excited to learn some more things. Let's start off with what kind of inspired you to go to pelvic floor physio? What kind of drew you there?
Yeah, no, that's a great question. I get asked that often. So so when you become a pelvic physiotherapist, well, we can't say pelvic physiotherapist technically as per our college in Ontario, so it's a physio with a special interest in pelvic health, but I'll just say pelvic physio to simplify things. When I was in school, ooh, like 8, 10 years ago now, um, as I was going through it, you learn about different areas of physiotherapy, and there's a ton of different things. And women's health was an area that I was initially really drawn to. And I actually joined the women's health division, which is across Canada. And I started learning about that as I was doing my master's in physiotherapy. And with that, I started learning about pelvic physio. And as I was kind of hearing about this, which again, 10 years ago is like a relatively new area of physiotherapy. It's only really existed maybe for about 20 years in total, but the last 10 years is where most of the work has happened. Um, and as I was listening to this, I was like, oh my God, I can personally relate to this. And at the time, I was a university student, never had kids. So when we talk about physio for moms, like it's really across a lifespan. And I was like, oh, I pee just in case all the time. Or I feel like I need to pee even though I just peed a second ago. And these different things I was starting to relate to. And I was like, I need to understand more about what this is for myself. Because it's not talked about. And I just thought that was normal and kind of went along with it. And so as I kind of was going through my schooling and learning about it and kind of becoming more in that women's health area, I really started to personally connect with it. And so I actually did my training as I was finishing my schooling. And when I finished, I went right into it. And so I've been doing that now, like I said, probably for about 8 years when I graduated. And it's really grown as a profession in the area that we do. And just, I feel like I'm just such an advocate because it's such an important part of women's health. but yet often gets neglected or not talked about enough. And that's why I'm truly so passionate about it. And I actually had started an Instagram account years ago to just learn about it. And as I started posting it, people started to reach out and be like, oh my God, I want to learn more. What is this? What is this? And so I think there's just like so much value and knowledge in making decisions and getting help that you need because I've had women that I've seen in their 80s, post perimenopause, and are like, I've lived with this my entire life and are, you know, like really sad, crying. And it's something that can be so treated and can actually, if not cure, substantially improve your quality of life. And so that's why I was like so drawn to this area and it can be so life-changing. So I'm always just like barbecue anywhere, like happy to talk about pee poo sex, everything, because it's just
Yeah.
so amazing in what it can do.
Yeah, yeah. I like I said, I wasn't aware that like even post childbirth, like years on, like it could still be helpful. I always heard, you
Yes.
know, you've probably heard it too, where mom's like, "Oh, I had my kids, and now I can't jump on a trampoline because I'll pee myself," or
Yeah.
like I sneeze or I cough and I pee
Yeah.
myself. I grew up hearing that. So when I
Yeah.
had my kids and I had my son and I sneezed one day and I peed a little and I was like, "Oh, that's just normal.
Yeah.
Everybody does that." Like
Yeah.
I had no idea. It wasn't until I had my daughter that I was like, "Oh, this is actually like something that can be helped." Like
Absolutely.
yeah, I
It's
was
what
totally unaware.
you'll often hear it's like common but not normal, right? So like you'll
Yeah.
hear it a lot and it's been normalized, but the reality is it doesn't need to be normalized. There's a lot you can do to make it better. So I think that kind of narrative is shifting, but still taking some time for sure.
Yeah, I'm glad that it's changing away from oh this is normal and to like oh it's common but we can help it. Like this isn't something that you
Absolutely.
should have to deal with
Yes.
on top of everything else that you already deal with on a daily basis, right? So you shouldn't be worried about being out in public and sneezing and peeing your pants a
Yeah.
little bit.
Yeah,
So
and that's
I'm
just
glad that
right.
it's getting talked about.
Yeah, it's empowering you to
Um
be able to do things that you want to do.
Yeah, exactly. I jump on the trampoline with my son all the time. I'm like, this is
Yay.
great. Why would anybody not want to be able to do this after? Like,
Yeah.
um, so what is kind of like pelvic floor therapy and why, like, what are some reasons that somebody would should see a physiotherapist for this?
Yeah, for sure. I have my pelvic model. I made sure to grab it from my car because I always have it with me on the go, especially on mat leave right now. So I'll talk a little bit about
Perfect.
what the pelvic floor is. So when you think of a pelvic floor, it's a region in your body. It's really that core, like fundamental part. Oh wow, my camera is adjusting as I talk. This is odd. Sorry if it's making you dizzy.
It's all
Okay,
good.
so the pelvic floor is a combination of muscles, bones, ligaments, nerves, connective tissue, and pelvic organs. As I said, it's kind of that core part of your body. So I'll show you the outside and then work our way in. So this is your pelvis. You'll have two sides to the pelvis on the back. And then this is the end of your spine, your tailbone. And then that's really that last piece of the tailbone there. And then you can kind of see it's like a bowl shape, and it is like a we call like a hammock. And there's 4 points. So you have your two bony parts in the front of your hip at the front here, and then at the right in the middle of the front, you have your pubic symphysis. So it's that middle part. And then, as I said, you have the tailbone at the back. So those are kind of the 4 points of the pelvis. And then if I shift it kind of from a downward view, anything pink represents a different muscle. So depending on what anatomy textbook you're looking at, there can be upwards of 12 different muscles, and there's 3 layers of the pelvic floor. And so here you really see is the outside. We have 3 holes. I always talk about that. We have the hole we pee from, your urethra, your vaginal hole, which is where you give birth from and have sex. Sorry, I'm getting over allergies, so if you hear me cough or sneeze,
All
and
good.
then where you poo from your anus. So those are your 3 holes. And then if you look on the inside, you can kind of see more of that bowl shape. Sorry, where again you see all the different muscles on the inside. The inside isn't hollow like this. There's a lot of things on the inside. For women, we have 3 organs. So in the front, you have, sorry, that the middle, you have your uterus. Right at the front, you have the bladder that sits underneath it. I can't really fit it in, but you can get an appreciation of how small the space is. And then at the
Yeah.
back, you have your rectum. So they all sit kind of in a really small proximity. And the reason why I show this is it gives you an appreciation of how much interplay there is between the pelvic organs, from your bladder, your uterus, as well as your rectum. And so when we talk about things like constipation or bladder issues, there's some interplay between it because, again, it's all in a really small cavity from each other. So that's kind of what it looks like from the outside. And your pelvic floor has a variety of different roles. There's actually five. So it helps from just like a stability control perspective. It supports the internal organs, those three that I just showed you. It also has a sphincter control for things like bowels, as we know, for continence. It has a sexual role, and then it also has a sub pump action. And when I mean sub pump action, part of that comes with your breathing. So if you've ever had pelvic physio, you heard of it, you'll always hear pelvic physios talking about the breath and why that's so important. And it also with birth. And that kind of connects to the sub pump motion. So we have what's called your diaphragm. It's your breathing muscle, and it sits just underneath your rib cage. So I'll imagine this is kind of your diaphragm. The bottom, you have your pelvic floor, which is again kind of that hammock kind of bowl shape, and they work synergistically. They actually work together. So when you inhale, your diaphragm lowers and goes down, while your pelvic floor does the same. It lowers and also goes down. When you exhale, it lifts and engages. So you inhale, you lengthen and let go of your pelvic floor. Exhale, you squeeze and you lift. So if you're in your mind, you're thinking like Kegels, and I say Kegels because it's so much more than just squeezing down there, and you may can personally
Yeah.
relate to having seen a pelvic physio. It actually is about that lengthening to prepare, make sure those muscles are relaxed, and then you squeeze and you lift. And that happens with your breath because your breath does the same thing, your diaphragm. And that's that pumping motion that I was talking about that helps to circulate and get things moving in that pelvic region. So that's your sub pump movement. And then this motion I'm talking about, so your diaphragm, your pelvic floor, are two of your four inner core muscles. So when I talk about inner core, I don't mean that like six pack, rectus abdominis, which yes, we all do have there. These are those deeper muscles, the muscles underneath your six pack. So we're talking about your diaphragm at the top. We're talking about your transverse abdominis, which is that corset muscle that wraps around your abdominal area and connects to the middle of that linea alba, which is connective tissue that stretches during pregnancy and often associated with diastasis rectus, if someone's ever heard of that before, where the abs just stretch out. Or not abs, but that linea alba stretches. The bottom, you have your pelvic floor, and then along the back of your spine, from the top of your spine all the way down to the tailbone, I call them your Christmas tree muscles, your little multifidus that run up along each segment of the spine. So those four muscles together make the inner core unit, which is that core, which is connected with the pelvic floor and how it works. So that's what the pelvic floor anatomy is in a very simplified, simple version. But I always say it's not, like I said, just pelvic floor, it's pelvic health. And what I mean by that is it's not just what's happening out there, but it's also about how you're sleeping, how you're eating, how you're moving, what's your mental health like. All of those things are so fundamentally important because they drive your pelvic floor. Your pelvic floor is like a sacred space. And if anything changes and shifts, or for example, we're scared, so there's this really cool research study that was done where they put electrodes all over a woman's body where the muscles are, and they got them to watch a scary movie. And the very first thing that activates when someone was scared was your pelvic floor. And it comes from this protective
Really?
place of just wanting to make sure things are safe because there's so many fundamental important functions of the pelvic floor that I just talked about, right? So,
Yeah.
of course, if there's something scary or we're in an argument with our partner or, we're afraid of birth and all the things that could happen, well, what do? We tense and protect there. And so that's why it's pelvic health because there's so much more than just how is that muscle moving? How are things connecting there? It's really about the person as a whole and that holistic approach. So I like to kind of put that in there to kind of give a bit more perspective of what a pelvic physio does. But as per the pelvic floor in itself, that's kind of the region and the part of the body and how it works.
That is cool. I learned some new information there.
You always
Cool.
learn
Yeah, I
more.
didn't realize that like everything was so interconnected. Like, yeah.
Absolutely. Yeah,
It
it
makes sense
really.
why when you're pregnant and like you always have to pee is because it's so small down there and they're always like
Yes.
pushing on like feels like they're always pushing on your bladder all the
Yes.
time.
Yeah, and
Like
like for
that,
instance,
yeah.
myself, I had actually nerve pain, and it was because baby was pressing on an area of the nerve because again, everything is already so small. So then you're adding a growing baby in there, things are going to shift and move. So much can change. And like when it comes to pregnancy, and I just realized your second question is who should see a pelvic physio? Well, everybody, babies, not babies, but women, men, and children if need be, and even like perimenopause, postmenopause. Like there's so many different reasons to see a pelvic physio, but everybody has a pelvic floor. So really it can be useful for anyone. But oftentimes the first time I have someone coming through my door is, hey, I'm pregnant, or hey, I've given birth and I've noticed these issues. So things like leaking with urine, pain with sex, constipation, feeling the need to go pee very frequently. There's so many different things, low back pain, hip pain, and a lot of it is interconnected because the body works so synergistically together from some of the things I said earlier. But especially during that perinatal phase, because your body is now growing another person, which is amazing, your body is adjusting and shifting. Well, it's a lot of load on that pelvic floor. So as a result, the pelvic floor is working harder to kind of hold and support everything. And oftentimes I hear this, well, I had a cesarean birth, like I didn't have a vaginal birth. I don't need to see a pelvic physio. Well, you've carried a baby for 9 months. That's taken so much load for 9 months. That in itself is a reason to see a pelvic physio, even if it's just a one check, make sure everything is good. And then there's also the cesarean kind of recovery with the scar and that in itself too. But the whole point is that there's so much that changes during pregnancy and beyond. And so that's usually the first time someone notices those shifts, and that's when they see us. But there's so many more other reasons that you could really see a pelvic physio as well.
Good to know. Yeah. Well, good to know that it's good for everybody, not just moms, not just, women in general. Like it can be helpful for men and children too, which I'm also sure that a lot of people, including men, let's be honest, are not like, at the point of acknowledging just yet or not aware that it could be helpful for them too. So hopefully this not only helps the moms that watch, but maybe their partners as well,
Mhm.
or their children. Uh, why why is it like important to do or to see a pelvic health specialist when you're pregnant? Like what can you do for someone during pregnancy?
Yeah, for sure. Well, I think there's a lot of different things, and the answer you'll hear all the time from a pelvic physio is it depends. Like there's so many different things, right? So it depends on what you're coming in with. If you're someone who just wants to optimize their pregnancy and prepare for birth, well, from a birth preparation perspective, you're thinking about baby's coming through birth canal, and your pelvic floor is right there. Your pelvic floor doesn't push your baby out, we know that, but it relaxes and lengthens. And that is so key. And oftentimes I have moms who are like, I got to do Kegels, I got to strengthen, 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 strengthen. That's actually the reverse of what maybe you need. And you don't know until you see a pelvic physio, because the only way truly to understand the state of your pelvic floor muscles is to do a digital internal assessment. And what I mean by that is you have one or two fingers gloved and lubricated, and they go internally through the vaginal opening and or the rectal opening to assess all those pelvic muscles. So when you're internal, you can see, if we kind of do an analogy, we do a lot of analogies because those are muscles you don't see, you just feel. And that's why pelvic physio can help you. So if you think of, let's say, a bicep, right? A bicep should be able to contract fully and it should be able to lengthen fully. So it has what we call that full range of motion. Now, if we're constantly doing that contraction of that Kegel, but we don't have full length of the pelvic floor, well, this is what we're doing here. We're kind of trying to strengthen in a very shortened position of the muscle. And if the muscle is stuck here, well, I can't really grab anything. Like my muscle is kind of stuck and stiff, right? And so you're not strengthening, you're just shortening that muscle over time, which can contribute to further issues if you already experience, let's say, pain or discomfort down there, or incontinence even, and or bowel issues. But in addition to that, what you actually need to work on is lengthening and letting that muscle fully relax. So for pelvic floor, if you're someone who's had trauma or fear or there's stress or there's a variety of different reasons that can cause that tension, what happens is that muscle is stuck there. So what you need to work on is actually learning to let go and lengthen that pelvic floor. And when you have that full length, then you do want to work on the strength, the flexibility, the range of motion. And working on that movement and that flexibility is what really helps you prepare for birth. So from a kind of physical, anatomical, muscular perspective, it really helps from that. There's also the whole piece about connecting with that part of your body and the psychological component, which I would argue is the most important part when it comes to birth, is you feeling safe, feeling in control, and understanding to connect with that region. The more you have that, the better you feel connected when you're going through that birth experience. And also just learning about birth preferences. There's so many things out there, and having someone to help you navigate that, whether it's a pelvic physio, a doula, a naturopath who specializes. There's so many different healthcare professionals that can, but kind of going through those things can be really helpful. with a pelvic physio, we talk a lot about the breathing and different breathing techniques to allow the pelvic floor muscles to let go. We talk about birth positions to help optimize your pelvis. So you always want to be in call what's a sacral freeing position. So if I bring my pelvis back, your sacrum is this kind of triangular part of the end of your spine. And if you have it flat against the bed, well, that part where the tailbone is isn't able to move. It's kind of stuck. And so you want to try to find ways where has more movement to allow everything to be more open during birth. We're kind of going a lot into birth prep, but there's a lot you can do from a birth prep perspective with a pelvic physio, even perineal massage, etc. And then there's those who come in with issues that can happen during pregnancy, whether it's, back pain, hip pain, um, pain with intercourse, feeling like you're having that incontinence or you can't really hold your bladder. Yes, as you get pregnant, that naturally happens because, as we said, there's just less space. But if you're someone that's running to the washroom every like 30 minutes and you're peeing 3 seconds, well, maybe there's something else that was going on even before you got pregnant. So there's a lot of different things that can happen during pregnancy where pelvic physios can really help with learning how to connect with your pelvic floor, get your body moving more freely with pain-free movement. And also building your strength. Like we think about like, you go through, let's say, a knee surgery and you're a sports athlete. You tend to do prehab, like you prepare in advance, you have your surgery, and then you have rehab afterwards. Well, same thing happens when it comes to pregnancy. The more you can be strong, that is safe and within what you're allowed, the more that can help with birth, because birth is a marathon in itself, let's be real. So you want
Yeah.
to be able to have the endurance, the strength, etc. And then the postpartum recovery, because like I was really taken aback by how weak you can be early on postpartum with things like just getting out of bed, moving. And so the more you can do in advance to prepare, the better off you're going to be postpartum and that recovery. Because not only A, are you recovering, you now have a baby that you're taking care of, which let me tell you, only gets heavier and heavier and heavier. So you need to be getting stronger, stronger, stronger. So there's so much in that sense as well. And then also, again, like looking at bladder and bowel support. That's a huge piece of what we do. So making sure you're going to the washroom the right amount of times with how often you're peeing, how long are you peeing, how are you peeing? Are you pushing your pee out or are you letting it just flow out? Bowels, how often are you having your bowel movements? Is there pain with bowel movements? Do you feel like you're not emptying fully? There's so many things we could go down. So I'll leave it there unless there's something that stands out you want me to kind of dive in further. But all to say that, like, whenever I have someone come in, they come in for one or two reasons and they leave learning a crazy amount of more that they even realized was something they could learn from. So
Yeah.
when in doubt, just go once and you'll be shocked how much more you learn.
Yeah, yeah, for sure. That was definitely a lot of information. Going back to like the opening of your pelvic floor, like during birth, you always hear a lot, and I don't know if I think it's more from like the holistic approach of birth versus the more medical like approach of it, is a lot of people birth on their backs, like when they go to the doctors, or when they have like OBs or something. I know I did with my son. I also had the epidural, so they told me there was no possibility that I was allowed to move. Mind you, I wasn't very well educated on any of the positions or anything as well. But when I had my daughter, I went into it knowing that there is different positions that you can birth in, and some of them are better than others. Ultimately, I ended up delivering her on my back because I was so tired by the end of it. I just felt like I couldn't,
Yeah.
be in another position. But is there like a position that you think is that kind of opens it the most, or like what kind of like how they're different, I guess, versus like birthing on your back versus on your hands and knees?
Yeah, no, for sure. And you said so many important things in there. And personally, I actually also birthed semi on my back, semi on my side. And I think like when it comes to this, the most important thing is about learning all these options so you feel empowered and or maybe having someone there like a doula to help advocate for you in those moments because it can be quite difficult, especially in a hospital setting. Because let me tell you, from a practitioner perspective, whoever's birthing on your back is the easiest for them to deliver baby. So that is the way they've been trained through the residency, all their schooling. So of course, that's going to be their preferences. There are different ways depending on how you birth, what you're allowed to do. Even on your epidural, you can still do a sacral freeing position. So when we talk about kind of the most optimal position, it's that sacral free position. So you can still birth on your back with sacral freeing. If let's say you're tired and you just need to be on your back, which is fair. I'm like I was there too. I think it's just knowing your options and being able to make those decisions. And it's not that you're in one position the whole time. labor is a marathon. Like you're going to push for, I would say, generally between 1 to 2 hours, especially if it's your first. So you want to change positions. Like that little movement is actually really key where you're not just stuck on your back all the time, unless that's all you're able to do. And if you are, that's okay. Like you still have breath that can help, right? There's still so many other ways. But if you're on your back, one easy tip that you can do is you get two small roll towels or towels and you roll them up and you put them on your sit bones. So if I bring back my model, you have kind of those bony parts of your bum. If you were to put your hand underneath it when you're sitting, you're going to feel that bony part. And if you've done any yoga, you would have heard maybe of that term, your sit bones. And you put those roll towels under there. So what it does is it creates a bridge on either side. So it's not flat against there. Yes, the bed's soft, it's a little kind of still cushion in there, but it gives even just a little bit of space to allow things to move. So that might be something you get your partner to do or a doula just to give it some of that space in there. And if you are able to, like I personally found lying on my side, kind of like a semi side sit or semi lie sit, where I'm a little bit upright, but not fully on my sacrum. I had some space free and I had a birthing ball between my legs. Actually, no, it was a peanut ball. That can be really nice where your knee is elevated to really open up that space in through there. So I was kind of personally somewhere in like this position and I found that was the best, but I was here, I was here, I was here. It's that movement, like changing it up. And I had an epidural and I was induced, et cetera, et cetera. Like there's still positions you can do as long as you're in the bed. I think the biggest thing with epidural is there's a fear of you falling because you don't have the same amount of muscular control in your legs. Every hospital is different in what they allow and how much they are able to. Some are even okay, and the practitioners working with you to get you on your stomach so the bed is elevated, the legs are lower, your top part's here, and you're kind of having your bum stick out and then your legs. I don't know if that's really makes sense.
Yeah, like the
Um,
beds drop kind of thing.
yeah, and that is amazing because you're kind of fully kind of allowing that to move well, and you're also allowing gravity to help to cut baby come down lower. So having that kind of using gravity to your advantage is really beneficial, which is like a modified version of a hands and knees, for example. So there's no perfect position. It's like what feels right for you in the moment. But trying to optimize that sacral freeing if you can and it works well for you, and then utilizing your breath with that. I think that can be helpful, which oftentimes I'll have, including myself, like hold your breath and push down and bear as much as you can. And so there's a lot of contradiction of like what works for you, but I think it's about just doing what's right for you. Like that is, if you're going in there and you're like, okay, my physio said I have to do this position, I have to breathe this way, and you're so focused on it that you're not connecting with that region to push out, well, that's not actually beneficial, even though that's what textbook says is, or not textbook, sorry, what the evidence is showing. It's really what
Yeah.
helps you feel right in that moment. And we're seeing that progress. So often I would see like, I'd get them to check and be like, okay, that's really working or that's not working. And then kind of going off of that and that flexibility.
Yeah.
I think there's a lot of like piece to kind of being flexible depending on what's going on.
Yeah, I definitely learned the second time when I had my daughter that they were very two completely different births. I had an epidural and I was induced with my son, and I spent I think 24 hours in a bed on my back the entire
Oh
time.
my
I
God.
pushed on my back and everything was on my back. I don't think I really moved much.
Yeah.
And I also didn't have like any of the education. So I didn't know the different positions. I didn't know like the breathing techniques. I had the epidural and they're just like 10 seconds, hold and
Yes.
push. And he came out, I tore, I couldn't feel very much. So I think that also like attributed to it. Yes, it took the contraction pain away, but looking back, I couldn't actually feel what was happening down there. So I was following their instructions
Yes.
versus really getting in tune with my body and figuring out what I needed to do. Versus with my daughter, I didn't have the epidural, which was by choice until the very end of it, of course, when I was like, oh my God, give me this.
Yeah. Yeah.
But with her, I was up, I was moving, I could feel
Yeah.
everything. I was on the toilet, I was on my hands and knees, I was all over the room.
Yep.
And with her, I very distinctly remember being like, they're like, okay, you need to push, like she's there. And I wouldn't. I refused. I was like, this
Yep.
baby is not coming out.
Yep.
And they're like, well, she's gotta come out. And like with my son, again, the hold for 10 seconds and push. With my daughter, I had midwives and they were like, okay, whatever your body is kind of telling you to do, like just
Yep.
follow that. And with her, it was a very slow and very painful exit. Like I was
Yeah.
very I was kind of like a little nervous about it, obviously, because it hurts.
Yeah.
But with her, I was able to be more in tune with my body, and she came out beautifully. There was no tearing. Like it was just a completely different birth experience, versus my son. So I learned a lot just from my own two experiences and how different they were,
Hmm.
because I had a lot more knowledge and education the second time going into it versus the first time. Um, which looking back, I really wish I would have done a little more research the first time, but it is what it is. You never know what to expect when you go into the hospital for labor. So,
Yeah. And
yeah.
like like knowledge is power in this. And like the more you know, the more it can, like what you're saying, makes such a difference, right? In what you want to advocate for or get someone to advocate for you. And like like when I think about birth, it's usually the first time a woman is hospitalized. And that environment can be quite scary in itself, right? So whatever you can do to feel more in control, to feel more safe, to feel empowered, that I think is truly the key to feeling a positive birth experience. And what a positive birth experience is for you and me, it may be completely different. Like I may want to have an epidural, I might want to be induced. I just want to know what's happening, when it's happening, and etc. And that's great. And I think that's what's more most important is like what's the most important thing to you and how can you kind of try to facilitate that and who can you have in your village to help guide you. And it's always different when you go the second time around, third time around, etc. You learn more and you understand your body. Like you really connect with your body in a different place. There is research that show also speaking to like the epidural and not having it, it does speed that second stage of labor because you do connect with that area more and you are able to full push and feel when those active contractions are. Funny enough for me, I had the epidural and I had to be induced, which I didn't want to, but I had prodromal labor and it was like 2 days of like on and off labor, which is crazy. Um,
Yeah.
I didn't want a high epidural and I asked if they could lower it. And I think in Ottawa they offer walking epidurals, which is like unreal. That's a whole area. In
Okay.
Toronto, they don't offer that. But I know that they had given the epidural and I was like, oh, I can still feel part of my body. And they're like, do you want to up? And I actually was like, not really. Like I liked it. So when I was actively giving birth, I actually was able to feel contractions, not fully, but a little bit, which I feel like in a way helped because I could connect with that area. So there is total benefit, but also from a pain management perspective, maybe that's what you want. But there's also different other pain management tools which maybe you used, right? So it's
Yeah.
again, it's knowing those options, feeling informed, feeling empowered, and doing what feels right for you. And what you do in that moment might be different when you prepare for it, but again, that flexibility is so important.
Yeah, I agree. Having the flexibility is key, I think, because I was so fixated on things with my son that when things didn't go that way, I was pretty upset about it. Where
Yeah.
with my daughter, I was like, okay, this is my generalized plan. This is what I would like. If that doesn't happen, here's some backup options. I also had
Yes.
midwives and a birth doula for her, so I just
Yes.
felt so much more supported in a way with her versus with my son and the OBs. I wasn't even, again, aware of midwives and doulas when I had my
Yeah.
son. So it was just, yeah, the flexibility and the knowledge really, really changed the experience for me. It really
Yeah.
made it more positive. And it's kind of why we're doing what we're doing here today, because I want to, help other moms, whether new moms or experienced moms, have access to that knowledge as well
Yeah.
and be able to prepare themselves and empower themselves for their motherhood journey. It's so different for everybody, and you never
Hmm.
know what's going to happen. My son was a NICU baby and my daughter came out perfectly healthy. So just being aware of your options, what may happen, what may not happen, and just going from there and really going with the flow of things.
Yeah.
Um,
And
yeah,
one thing I would say is sometimes too, like you prepare, but then you're presented with something that you didn't prepare for. And that's
yeah,
okay too. You have to remember that they do this day in and day out. Like for them, this is just their job. But for you, this is the first time it's happening. So ask those questions. Like that's the one thing someone told me that, and it was so insightful that you have to realize that's their job, but this is the first time you're doing it. So it's okay to ask those questions and in the moment see what makes sense. And it's okay. You can be like, hold on, I'm not ready to make a decision. I need a few minutes. And so it gives you that space to kind of ask what are the benefits, what are the risks, what do I want, kind of are there alternatives, kind of going through those pieces because even in that moment, you can prepare all you want, but things just sometimes go not according to it, right? And you can't prepare for everything,
yeah.
and that's okay too. But just keeping that in mind, I found for myself was very helpful too. Even as a healthcare professional, I still was faced with things that I had no idea about. And that's just the reality of birth. There's just endless things that can happen, right? So
Yeah,
whatever keeps you safe and the baby safe. That's of course number one.
exactly. Exactly, for sure. What else do I have here? Um, I feel like we've answered so much of these just by like kind of chatting.
Yeah, for sure.
What are some common like pregnancy related symptoms, I guess? Like if somebody like the constant urination that we spoke about, back pain and hip pain, I didn't know that like
Mm.
physio was helpful for that during pregnancy. I had no idea.
Yeah, for sure.
Um,
I'll talk a bit first about the incontinence and then I can talk about some of the hip and back pain as well. So
yeah.
for incontinence, there's three types of incontinence that can happen during pregnancy, after pregnancy, with birth, postpartum, perimenopause, et cetera, et cetera. Like it can happen at any point, even before, like again, someone in their 20s never had a baby, that can also happen. So the three types, there's one that's called urinary incontinence, which is probably, stress urinary incontinence, which is the most common type that you hear, which is what you had talked a little bit about I jumped on a trampoline and a little bit came out, or it just completely gushed out. So that's with laughing, sneezing, coughing, jumping, some sort of explosive type movement, running, anything like that. So if we think back to when I was talking about the anatomy of the pelvic floor, you have your diaphragm at the top, which is your breathing muscle, and then your pelvic floor, which is all those muscles at the bottom, like a hammock. When you have any of those movements or coughing, sneezing, laughing, etc., what happens is your diaphragm comes down. So when it pushes down, if you think of this area like a canister or like a can of Coke, you now have more pressure in this area. And if your pelvic floor and your inner core unit, those four muscles I talked about, aren't working functionally and synergistically, well, what happens is with this increased pressure, you have a little bit of trickling of the urine that comes out. So that's really just that increased intra-abdominal pressure in your thoracic cavity, and then your core isn't working optimally to control that pressure, which is why you have that leaking of the urine. It can be a little trickle or it can be a lot, might depend on how full your bladder is, etc. That's the first type. Second type is urge incontinence. So I tend to see this a lot with more my younger pre-baby or sometimes with pregnancy even or postpartum, where you kind of have this thing where you might have a physical trigger. So I call the like key and lock syndrome, where like you're coming home, you put your key in your door and you're like, I need to run to the washroom. And if I don't run to the washroom, I'm not going to make it, or you pull into the driveway, or you're showering and it's the water running. There can be a lot of physical triggers, or there can be dietary triggers like caffeine, wine, tomatoes, chocolate, all these amazing things that are generally more acidic. And so what that is it's irritating your bladder. So your bladder, it's called a detrusor muscle. And then you have your pelvic floor. So the bladder and the pelvic floor work opposite to each other. So when you pee, your detrusor muscle contracts and your pelvic floor relaxes and it just flows out, which is why we don't push your pee out. You let it flow. And then when we're continent, our pelvic floor is a little contracted to make sure, and our detrusor, our bladder muscle is more relaxed. If we try to push our pee out, just as a side note, we're doing this at the same time, which then can create a whole bunch of miscoordination problems. So you want to make sure that doesn't happen. You let it flow out. And then the other thing is when I was talking about kind of that key unlock, what's happening is, or let's say you had wine and you feel like you need to go a bit more, is your bladder gets a little irritated. So it kind of starts to spasm, which makes you feel like you need to go pee more. And it's not that necessarily your bladder's full, it's either that the urine is more concentrated because maybe you're dehydrated, which people tend to do thinking it'll help, but it actually does the counter because urine is quite acidic and when it's concentrated, it can create that irritation of the bladder. And so then you feel like you have a full bladder, but it may not be full. And then there's this whole thing about peeing just in case, which I don't know if you talked about ever with your pelvic physio. And it's one of the things you'll hear us all say is don't pee just in case. Same thing for your kids, same thing for your partner. That's something that goes across the board. You want to go to the washroom when your bladder is full. If you go to the washroom before your bladder is full, you're now training your bladder to pee before it's full. So instead, if this is your bladder, this is like full, this is empty, and you're halfway and you're like, okay, let's go pee because we're going to go drive for 20 minutes. Now you're emptying your bladder from a halfway. So what happens over time is you're teaching your bladder to go pee at a lower threshold. So it's not that you have a small bladder, it's that you've decreased the threshold and you're confusing the brain and the bladder connection. Your bladder's supposed to tell your brain when you need to pee, not your brain tell your bladder. So that really mixes up the signals. And that's like that whole kind of uh, urge incontinence where there might be some faulty bladder habits, which again can happen across the board with anyone, but I just in practice see it a lot with adults. who then teach their kids that when they're potty training, which can become an issue, but we'll leave that. Um,
Okay.
and so it's about kind of retraining the bladder, getting rid of some of these irritants while we kind of add them back slowly. And so what happens is you have this irritant, the bladder spasms, your muscles are usually more tense, so they're not strong enough, but they're stuck in that contracted position, so they don't have the range of motion to relax, and then you leak a little bit of urine. So that often happens and is also often connected with pain with intercourse or internal pain with like tampons or anything like that because those muscles are kind of stuck in that guarded position. So that's the second type of incontinence. And then the third type is called mixed urinary incontinence, which is just a combination of the two, where you have leaking with both of them, sometimes more one than the other. So different types, I would say with pregnancy, I tend to see most with the stress, urinary incontinence, and postpartum, but there also tends to be a sub cohort of women who come in with that and then also had the other one but never knew because they've never seen a physio until they come see me and they're like, whoa, I didn't realize that. And that can sometimes change. But then with pregnancy, things are more amplified because you have hormones that actually make you pee more frequently, and then everything gets in a smaller proximity. So there's that kind of amplifies it. So you can still work on it, but it may not be as much of a change until afterwards. Um, so that's kind of the incontinence piece. I'll just pause there in case you have any questions before I move into the pain side of things during pregnancy.
No, I think I'm good. That was, yeah, the whole like peeing before you leave the house thing. Very guilty of that for
Yeah.
me and everybody in this house, actually. Yeah. Yeah,
So
I didn't know that was not great.
I know, but I will say with that, there's a caveat. So there are some times when you're allowed to pee just in case. So when you get up in the morning, usually that's your biggest pee, your longest void, I should say. Each time you void should be about 8 to 10 seconds long, Mississippi seconds long, which is about 5 to 7 times a day as an adult. If you're peeing less than that, you're probably dehydrated. And if you're peeing more than 10 times, then you likely have this increased kind of um, irritation, frequency, kind of something kind of with your bladder that's irritated. And so long as pee in the morning. Before you go to sleep, you want to make sure you empty your bladder before your bed. And it's not normal to pee overnight unless you're over the age of 50s and going through menopause with the hormone changes. So peeing overnight isn't, although when you're breastfeeding or pumping, that shifts things during that early kind of postpartum piece. So we'll leave that. But otherwise not normal. After sex, just from making sure everything kind of is clean and from an infection perspective or prevention. And then let's say you're going for a drive, but it's 2 hours long. If it's a long drive, that's totally fair. You should be able to hold your bladder for about every 1 to 2 hours, which is, like I said, about 5 to 7 times a day. If you're going for, let's say, a 10-minute drive and you're going somewhere where there is a washroom, that's not ideal. Same thing with your children, right? It's about making sure your bladder knows it's allowing it to fill, and then your bladder tells your brain, okay, it's time to go pee, not the reverse. But let's say you're going to be in the car for a quite of a long time, then that's okay because you do want to empty it to make sure it allows for that 1 to 2 hours. So I think there's that caveat to it. But generally speaking, yeah, peeing just in case is a big no-no in the pelvic world, and you'll hear that from almost every single physio you talk to.
Good to know.
Yeah.
Good to know. Yeah, that was not. Yeah, no. I think that's always been a thing. As long as I've grown up, it's always like you have to pee every time you leave the house.
Yes. I
Yeah,
think everyone's
that's
guilty of
good.
it, including myself.
That is good to know.
Yeah.
Yeah, let's move on to the back and the hip pain that we were talking about there
Yeah,
with
yeah, for
the how
sure.
you can help that.
Yeah, for sure. So with hip and back pain, one of the most common things we see is pregnancy-related pelvic girdle pain, which really, when you talk about your pelvis, is kind of this area here. So whether you have pain in the hip at the front or your this is your pelvis. Sorry, I'm having a mom moment here. So
It's
on
all
either
good.
sides, where you can have it in the front, in the back, in your tailbone. Sometimes you have it in the front, your pubic symphysis. Some people talk about pain in through there. Some people have it along the spine. Anyways, any of that area in the pelvis during that phase of your pregnancy, really, it can be considered this, and there's an assessment to determine if it's not. And what that can be, it's a combination of different things. For some people, it's just baby's growing, there's a lot in that area, and there's a lot of pressure and heaviness, and maybe the core is not working strong enough. And so it's about kind of reconnecting, making sure we're moving the bones, moving the joints, getting them moving freely because we're just not, because we're scared and we want to keep everything in. It's about connecting with the muscles to make sure, like I said, they have the length and the flexibility and the strength. But a big piece of pregnancy-related pelvic girdle pain actually has to do with pain science. And I often say pain is an output of the brain, not an input. So what I mean by that is we have different factors that kind of come into the brain to determine, is this dangerous? Is this a threat or not? And then that creates the output of, this is pain. And so when we're pregnant, especially in that first trimester, there's so many scary things, and even during pregnancy that come up, whether you've had trauma, you've had a miscarriage, et cetera, or you're just fearful if everything's okay. And so again, going back to kind of what we do and how sacred that part of our body is, we tend to hold a bit of tension and kind of be in that contraction because we want to protect. And sometimes the way I say it is, we love our body a little too much. That's the easiest way of simplifying it. And so as a physio, we try to help you connect with that area and feel safe and help it to let it go. Give it some TLC, which might be some internal massaging work. It's a lot of breath work. It's a lot about looking at your life and kind of helping to optimize your health because again, a lot of things drive it outside of that physical part of your pelvis. So it might be more about fear of birth and you're scared of tearing and then you're holding on or you're afraid of X, Y, and Z. So it's helping to kind of reframe those pieces by empowering you in other ways, getting some movement that's pain-free and helping you learn to use your breath to kind of activate your core and move as you get bigger and heavier and things get more awkward and uncomfortable. And then also just keeping that strength, so maintaining that piece. So there's a lot of different components of how we work through pain, and it also depends on kind of what's specific. But that pregnancy-related pelvic girdle pain, it's about a lot of that kind of more holistic approach because there's a lot more to pain than just, ow, this spot hurts, I need to massage it.
Okay, good to know. Good to know. I like that. I genuinely did not realize that there was so many things that you guys could help with. Like back and hip pain. Like I've just, they've been so normalized during pregnancy and
Yeah.
everything that you just kind of experience it and you're like, okay, it'll stop eventually. Or, after the baby comes when I'm not big and round anymore, like it'll go away. And
Yeah.
sometimes it just doesn't.
Yeah.
So it's good to know that you guys can help with that. We're running out of time here, but we've mostly focused on I'd say like pregnancy and birth. So I just want to ask you like one more kind of like postpartum based question before we head out here. When is the best time for someone to see a physiotherapist after they give birth? When should they come see you guys? What can they expect to happen?
hmm So I'm going to go back to it depends. And the reason why I say that is everyone's so different with their postpartum recovery, right? That fourth trimester is those first 3 months after birth. So much is changing. You're in that kind of survival mode of you and baby and change of life with your partner and house. And so it's when it's right for you. There's never too early of a time and there's never too late. So once postpartum, always postpartum, I say. So you might be coming, you might be feeling like, okay, I really need someone to help me move out of bed. Like movement out of bed is really hard, or even during pregnancy, because that's also a piece, how to move better. And so you might see someone really early if you feel like you're able to go or they're able to come to your house. Or you might be someone that's like 2, 3, 4, 5 years postpartum, but still dealing with it. That's also still very okay. But from when we're talking about post-birth, I would say typically when you go see a pelvic physio, those first 6 weeks postpartum, we don't do any internal work. So I mentioned a part of what we do is we assess the pelvic floor internally to see how the muscles are moving, the connection with the fascia, the bones, etc., everything in the pelvic organs. We only do that after that 6 week mark, once you've had your check with your midwife or OB, where they've essentially cleared you medically. And often I hear like, oh, I've been cleared medically, but like I'm still dealing with all this stuff. They're doing the assessment to see is there any infection, anything from a very medical lens, but they're not actually assessing how your breath is, your strength, the flexibility of those muscles, how they're working optimally within each other. There's so much that a physio does that isn't captured with your medical professional from birth. So they're both very important, and I think everyone should go after giving birth to do that check. But that's only done once we've been medically cleared. And oftentimes they're like, well, I don't know if I was. But if they tell you you're safe to return to sex, if you can have a penis internally, one finger you definitely can. And often you want to start with a finger before a penis because that's way bigger and it's more jarring, et cetera, et cetera. So it can actually help
Yeah,
work
that's
towards that
scarier.
goal because sex postpartum is a whole other thing that we could spend a lot of time talking about,
Yeah, of
right?
course.
But yeah, so when it comes to that, we do that post, that 6 week check, but there's not that we can't see you earlier to work on things like breath work, movement, an external kind of overclose, kind of seeing how that's connecting because you can still feel quite a bit if you're an experienced pelvic physio. And or let's say you're someone who's had a cesarean birth, you also want to do a lot of scar work, and that's not internal, but you want to make sure the scar is closed and healed. That in itself is quite a lot of physio that you would want to do outside of the pelvic floor. So there's a lot that needs to be done and is worked on. It's just a matter of where you are and when you're ready. Like first thing, make sure you're working on your sleep, your as much as you can, of course. Your nutrition, like are you fueling yourself? And do you feel like you have that capacity to work on it? And if you don't, that's okay. It's never too late. You go when you're ready and you're able to. Sometimes I have people who come and they really want to, but they're just not in a place. And I would say you want to use your energy in that moment. What's the most important, what you need in that moment. So that's, I think you need to have that in perspective. But generally, that's kind of our timelines of when we see. And then after that fourth trimester, those 3 months, I tend to see more moms once they kind of have a bit more of an established routine with their newborn and things are moving a bit better. And then you kind of work on that. And a physio, how often they see you is different than an orthopedic physio. It's not someone you're seeing 2, 3 times a week generally. It's more, let's do periodic check-ins and let's give you some homework. You're going to work on this and then we're going to come back and see how things are going. So it's a little different and it's kind of nice because you don't need to be with the practitioner so frequently. Again, it depends on the case, of course, but there's a lot of things you can take home, practice, and then continue when you see them next.
Hey, cool. I didn't know about the scar, like the scar physio, like that. What is that?
Yes.
What is that?
Yeah, no, for sure. So when you talk about like a cesarean birth, right, there's that scar usually under the belly button area, and there's a natural healing process that happens with it. But oftentimes, or not oftentimes, every time you have collagen, which is the scar itself healing. And the most simplified and way to kind of expedite this conversation is that once you have a scar, things are kind of stuck together. And the way to get it unstuck, to get it moving freely, because sometimes you have back pain and it's because the core is not working optimally because everything's stuck, is to actually massage that area and get it moving a lot. Or often I have moms who are like, that area is so numb, I don't want to touch it, it's gross, like get it away from me. But doing massage work and desensitizing the tissues to that normal sensation again is extremely important. And that also works vaginally. So vaginal scarring, if you've had tearing. So doing massage in that area, because let's say if you're going to work towards sex, but there's scar tissue there, that is going to feel like rubbing, frictiony. You might also not have as much natural lubricant, so having a vaginal moisturizer and lots of lube. There's so many ways from a scar massage to work on both, but it's really about connecting with that tissue, massaging it very light to start, and then working deeper to get things to move and be unstuck, essentially.
That is good to know. I've talked with quite a few C-section moms, and yeah, the one thing that I hear frequently is, oh, it's numb, or a lot of people say that it's really itchy all the time.
Yes.
Um, and I personally don't have any experience with C-sections. I didn't have them. So yeah, this is really, really helpful and really insightful. And I think a lot of moms will find that helpful because, like I said, I didn't even know that
Hmm.
that was a thing. So that's, yeah, I'm excited to share that with a lot of my mom friends actually.
Yeah.
So.
And
Yeah.
if
Okay.
you
Well, do
have,
you
if
want
there's,
to?
oh, I was gonna say one more thing for a
Oh,
scar. Quick thing, if you're someone listening to it, or you know someone who's had a scar for a while, sometimes scars can get raised and are thicker. A keloid scar, silicone gel can also be really helpful over there. And if you're earlier, castor oil when you're massaging is also really great to break down the scar itself. Once again, everything's closed. But those are really easy things if you're listening or you know someone else that you can just like get on Amazon and get that going.
good to know. Good to know. Love that. I have a few clients I can share that with. So yeah, that is super helpful. Do you just want to tell us your socials, where we can find you, how we can contact you, anything like that?
Yeah, for sure. So I believe this is going to be done through YouTube, and if it is or isn't, I am on YouTube, not necessarily as active, but I have a lot of other free kind of movement, exercise, pelvic floor stuff on there. So it's my first name, Leah D. Physio. So you can find me on YouTube, and then I'm more active on my Instagram and or my TikTok, maybe not as much, but it's just Lead Physio. So Leah D. Physio. I try to kind of do a mix of motherhood now that I've entered that phase, as long as pelvic physio. So there's a lot of free stuff on there. I do actually have, for anyone who wants to connect with their pelvic floor from an audio perspective, It's a bit old now because I did this when I was working before going through pregnancy on Spotify, but it's a pelvic floor guided meditation. And there's like 10 different audios that you can kind of work through the breath work and connect with that area. I will warn you the audio is not great quality, but it's really nice because it gives that facilitation just to start. So that's a free resource on there. I can send that to you to have for anyone who wants
Yeah.
to as well. And then, of course, you can connect with me personally. I'm happy to provide any other resources. If it's anyone listening in Ontario, I can always provide virtual care. But if it's outside Ontario, then I would recommend just checking the College of Physiotherapy, and you can find other physios within your area as well.
Awesome. Sweet. Well, thank you so much for taking the time to chat with me today and do this interview. I think this is going to be like incredibly helpful for so many
Oh.
moms out there. And I wish I would have done this before I had my kids because, yeah, information I could have used before.
That's
So,
okay. Now you know and you can share with others. And like, I love talking about this. I think there's so many different things to talk about. I always feel like there's just never enough time. But I think there's some really good nuggets that hopefully some, if anything, just at least one thing to take home with them. Because yeah, everything you learn makes a difference.